What I would encourage parents to do is really look at their child before it gets to the point of there's a problem, because unfortunately we often, with our family members, live in a state of denial, and we make comments that it couldn't happen to my family member, it couldn't happen to my child. And parents need to really wake up and understand it can happen to anybody. It doesn't matter socioeconomic class, it doesn't matter background. Those things need to just be put aside and really look at each individual child of what their needs are. Because unfortunately, once parents recognize that there's a problem, it's usually already a big problem, because usually the recognition comes when legal issues have come up or health issues have come up. And so helping parents really engage earlier with their elementary and middle school age kids, of focusing things on safety, on understanding the harmful effects, of also being very open with their children to talk about what they're feeling, and opening up a dialogue, so if they are struggling or they're having issues, that it's okay to talk about it. Because often we find that kids end up using because they're covering up for some pain that they're avoiding. And if we can teach them skills from the beginning of how to deal with painful things that come up, it's going to help in prevention of ever getting to that point where you're getting that phone call from the police or that phone call from the school that there's been a suspicion or a suspension, or even worse, you get that phone call from the hospital that your kid has died. And I think we've got to start early. I think there's a lot of things parents can do as far as making their homes safe. Just in our society right now, although the restrictions have increased with opioid prescriptions, you don't leave those in your house. If you have been prescribed some as a parent and you've got pills left, do not keep them at your house. Dispose of those. I think even as a parent, or even if you take your kid in for an injury or a health issue, know you have an option that if an opioid is prescribed to you or your child, you can say, no, I would like something else, where you don't even risk going down that slippery slope that's out there. Again, opening dialogues, being aware of where your kids are, who they're hanging out with, what they're doing, paying attention to subtle signs of isolation, of are they talking less, are they changing their peer group, are their grades slipping just a little bit, are they less interested in the things that they were once interested in. And I think when you see those, without being confrontive of, oh my goodness, my kid must be using something, of just being able to have the dialogue established in your family, of just being able to ask the question of, are you okay? Do you have anything to talk about? And just making it okay for kids to say how they feel and express those emotions.